Criteria for the prognostic: you have a good prognostic if the cells are cleaved or they have a small cleavage, if they're still small, if the cells are mature, and if there is a presence of follicles. You have a bad prognostic if the cells are not cleaved yet, if they're large, if they're immature, and worst case scenario, if they're diffused. So now we're going to talk about the stages. There is stage 1, 2, 3, and 4, and each stage can be either A or B. So for example, say the patient is stage 2, they can be stage 2A or stage 2B. If it's stage 1, this is what we call a one-node site. So the adenopathy that we spoke about earlier in the symptoms is going to be, there's only going to be one nodule, and it's going to be around the neck area. If it's stage 2, you're looking at more than one site, both on the same side of the diaphragm. That's the important thing to notice about stage 2. So both above the diaphragm. Stage 3, both sides of the diaphragm. So above and below. Stage 4, this is what we call extra-nodal sites, meaning that not only you're above and below the diaphragm, but you also moved laterally as well. So now moving on to the A and B classification. A simply means that there is the absence of the B symptoms. The B symptoms are fever, night sweat, and weight loss. Or B is when you have one of these symptoms. So for example, if it's stage 1A, that means they do have the adenopathy, but they don't show any symptoms of fever, night sweat, or weight loss, for example. Stage 2B, that means that they have nodules on both sides above the diaphragm, and they also show symptoms as mentioned over here. Diving a bit more into the prognostic,